nurses have continued to be nurses.
Going from being extremely burned out because of the environment that I was working in to facing moral injury at the bedside. We can't be any more resilient.
We've had people leaving the profession. Those remaining are questioning, should I stay?
I'm hearing tragic and heartbreaking stories from around the country from nurses and healthcare professionals. We need help and we need change now.
At least twice a week, we receive messages from people who've lost someone recently.
For me, I had to switch to part-time because I think I recognized early that I was kind of having some signs of burnout, and I never want to be that nurse. So.
And then that night at my wedding, I'm putting my dress back in my bag, and it reminds me of the same white, body bags. And I'm like, how am I thinking of this in the happiest moment of my life?
I experienced suicidality. My belief was at that time, there was the only option was not being here, not existing.
This is not isolated. There are nurses and healthcare workers across the country that are struggling. A lot of people have told me that they've lost a colleague during this pandemic to suicide.
At some point, our systems, the environments that we're in, have to change.
What will happen if we don't really change the way that we're caring for the nursing profession? We'll probably have increased risk of patients dying because medical errors are going to occur. We will continue to have people in the hospital that need help, and if we don't have great people to take care of them, it will be very difficult for us to really solve that puzzle.
With the pandemic, we just saw, people placed in an extraordinary situation.
That's driving through empty streets to get to work, being told you better have your ID on you in case you get stopped by the National Guard or something. Terrifying to hear that.
We went into what now feels like 2+ years of not knowing how much is expected of us.
I was on a unit that was incredibly short-staffed, was a revolving door.
For many nurses, this meant a change in their role very quickly. And by that, I mean working in more specialized areas that they were not necessarily trained in.
Previously, you would have a mentor or a preceptor for maybe 6 months before really fully going into your role. Now you get 3 weeks.
It was very stressful and continues to be.
How can healthcare workers be expected to be okay if we can't even seek help without fear of stigma, without fear of losing our jobs?
As we have in nursing for decades, we have had this growing concern of a nursing shortage. And certainly we have seen that happen over the COVID period as well, with nurses fleeing from the workforce, with nurses experiencing tremendous stress and mental health angst. They're short-staffed. Their assignments are more patients than they really are prepared to care for or have the bandwidth to care for. And that includes in intensive care units.
It's the little things, little tiny tech things, I think, that kind of start mounting. If you spend 3 hours searching for a cable, those things I think add up. And that's what makes you feel like you're a piece of crap because you didn't provide great care whenever you have the capability to do so. It's just you don't have the resources, you don't have the staff to do it.
You're the hero. The nurses are the hero, and we give the care to the ill, but we are not the ill.
We really don't promote taking care of the nurses before they get sick.
Within the guidelines that are placed for a nurse to maintain their licensure and be a nurse, they cannot be also the patient or the ill person.
I definitely work with heroes every single day, but I do believe that if we were truly heroes, then we would be supported by our employers.
We have in nursing been relatively reactive instead of proactive to creating a workforce that is sustainably strong.
I mean, I don't know about you, but I don't really feel like a hero. I mean, I think most of us feel that this is a calling.
I think humanizing nursing instead of putting us into this weird hero narrative is so important. And using that narrative does not help us, and it kind of helps excuse what we've gone through.
We don't need a hospital system to wish us a happy Nurses Week and provide a pizza party. We need real life, actionable changes that are going to be happening soon.
Nursing is a profession about giving oneself to service, but you can lose oneself in service. Nurses have to remind themselves that to be the best nurse, you have to take care of oneself.
One of the worst things I think nurses have adopted is this stance that, it's just part of the job. You're selling yourself short, and you really have to think about what this has all done, to you and for you.
We need an institution that's going to take leadership post-crisis and start taking important actions.
Looking in the mirror and recognizing that, what they are doing currently is not working. And that's hard. I mean, that's vulnerable, that's difficult. But whoever takes that first initial step is going to be groundbreaking and is going to lead the way to change that is going to save us.
But it can't just be nurses' resilience. It has to be changes in the healthcare system and the workforce and healthcare models that allow nurses to be in settings that really do protect and promote their health, and that maximize nurses' unique skills and knowledge and competencies to provide them rewarding experiences of taking care of patients and helping patients heal and recover.
There will be fewer RNs in the field, and we have to figure out how we're going to design models of care that fit various clinical settings. And it's not going to be a one-size-fits-all. To recognize that everybody's been through a traumatic event. We're all trauma survivors. And the way we handle this as leaders is going to determine our future going forward.
But I think more than ever right now, we really need to be focusing on the basics, taking care of ourselves.
It's really important for you to have the skill set, not just to be able to pass meds. You have to know how to manage your own stress and take the time out for your own personal well-being. I feel that it's important for us to have environments where nurses and health professionals are working, where it will really support that type of a structure.
There are a few best practices that I think many institutions would be wise to buy into. One of them is the HEAR program, the Healer Education and Referral Program. They provide free, confidential, anonymous screening every year to every employee so that staff members actually have a way of self-determining their risk for various mental health issues, up to and including suicide, substance use. And then once they complete that anonymous screening tool, they have immediate access via an encrypted pathway to actual meaningful referral resources and then long-term counseling.
And like the overarching goals of the Don't Clock Out initiative is normalizing these conversations amongst healthcare workers.
We're hoping to provide free therapy that's completely absent of an employer or an insurer to healthcare workers.
So that they don't have to sit in those emotions and develop these feelings that lead to moral distress and mental illness. Hopefully, if our test flights go well, if our initiatives go well, maybe these things can be implemented nationwide, and that's really, really the goal.
Those little small pieces are going to come together and make true lasting change.
What's coming out in initial data that is starting to get published is that just listening to nurses around their needs, around what they need for resources, around connecting with one another, seems to make all of the difference.
Remember, the nurses who are caring for you are also human. They also have families, and they need to be treated with respect. They needed to be treated as a teammate for you as a patient or your family member to get better. I think we think of nurses as these superhumans, right? They can do everything. And when they go to work, everything that happened at home was left at the door when they enter their new office or the hospital or wherever they're working. Part of being a human is the fact that we're complex and that we have to think of ourselves not only from a physical perspective, but also from a mental health perspective. And if those two aren't connected and those two aren't balanced, it's very difficult for us to be able to be our best.
A lot of nurses, a lot of healthcare workers weren't seeking help in the beginning because we were used to these issues. We were so used to it. We built that resilience that everyone talks about.
One of the first and most simple things that we can, and I think should be doing, is normalizing the process of asking for and receiving help, which culturally for nurses can be super difficult.
This is an environment that does not allow for coinciding or concurrent documentation of a nurse or a healthcare individual exhibiting symptoms that a mentally ill person would exhibit.
You can't see a mental health issue. It's not like a broken arm or a broken leg or a big cut on your head.
You know, it's more than just once you're aware. It's more than giving cookies and treats to the nursing station. This is giving a place for nurses to be a patient.
So let's not wait until our nurses break. Give more available resources within the employment community. Seeing that taking care of our nurses' well-being is a part of their career journey, not an event.
It might be something as simple as, how do we better coordinate with our housekeeping department so that nurses can focus more on the patient? It may be around connecting nurses with other nurses or having a quiet space for nurses to gather themselves. So these are what we're beginning to listen to and learn about so that we can come up with more targeted solutions.
If we can do that in workplaces, in our society as a whole, not just kind of hide mental health issues, but actually talk about them and be understanding and try to provide resources, it could definitely make people feel more comfortable with saying, I do need some help. It's okay to be a nurse who's caring for everyone and to also say, I need some help.
We're not great at asking for help. We're not great at really having insight about when we need help, which makes it all the more important that when we recognize behaviors in our friends and colleagues that are concerning to us, that we reflect that back to them. Because sometimes an individual is not necessarily going to have the insight to understand when they need help the most.
I'm just grateful that we have some excellent research showing how we can best help nurses, support nurses, so that we can be our best.
I have a lot of hope for future generations of nurses. You do want to be a good nurse. You do want to be committed to your career, but you need to be committed to yourself first, and then your family, however you define your family, and then your profession. That's the rank order of success.
Nursing is one of the best careers ever, and I say that wholeheartedly because it allows me to do so many different things. I enjoy my role as a nurse, and I'm hoping that if there is someone out there who is considering nursing as a career, you at least talk to someone to say all the wonderful things that a nurse could do.
I see you. I see you. You're out there struggling, or even in the depth of your mental health. Maybe you're not even struggling, and kudos to you, but I see your mental health.
You know, seeking help for your mental health is not a weakness, it's a strength, because your patients are going to be under the care of your best self, right? Once you are, taken care of, that's what's important. So
We have a lot of work to do, and we just got to start talking about it. And we can be ashamed, but let's just talk about that too.
That's why we at Psych Congress want to reclaim Nurses Week and take it beyond perhaps the token gestures of appreciation, and instead have real conversations about our mental well-being. So I hope you'll join me and your colleagues from all over the country talking about this most important conversation of mental health and well-being.
And all I can say is this: thank you. Please know that what you do matters. You matter. I want to invite all of us. Let's join forces and advocate for better support for nurses.
In this series, we hope to show you we hear you, we support you, and we value your unique contribution to the work we do.
We have an institutional obligation to change.
I see how you're facing your challenges and I hear your struggles at work. So this year, we are reclaiming Nurses Week together and calling for real institutional changes.